Doctors, what was the most incorrect self-diagnosis you've encountered? This happened in med school. I was taking the history of a guy in clinic, and I asked about his past medical problems, including if he had had any heart attacks. He responded, "Oh yeah, I've had about 20 of those." "You've had 20 heart attacks?" "Yep. Which doctors did you see about them? Do you have a cardiologist?" "Nah, I never went to a doctor. My wife is a massage therapist, and whenever a heart attack hits, she starts to massage some pressure points and it stops." "Oh, okay. What does it feel like when you have a heart attack?" "I don't ever remember them. My wife tells me that I fall onto the floor and my arms and legs start jerking. She says it takes about a minute of her massaging before it stops. I then get really confused and tired afterwards, and I can't remember much of anything that happens to me until I take a nice long nap." The dude was having seizures and thought that they were heart attacks. They normally stop on their own after a few minutes at the most, and his wife thought that her massages were curing him.
That's wild. It's crazy how people can completely misinterpret their own health issues. This guy thought he was having heart attacks, but it was actually seizures. And his wife was just trying to help. It's a reminder that not everyone gets the right medical advice or even sees a doctor. Guess sometimes you can't really rely on DIY methods for serious stuff. It kind of makes you wonder about other misconceptions people might have.
This is only tangentially related to the topic at hand, but gave me great joy at the time, so I thought I'd share. During my time as an intern, a patient was admitted for anemia, hematocrit of 16, requiring blood transfusions. Turns out that at some point in the past, after she was diagnosed with an inborn error of metabolism, her primary care physician prescribed her vitamin B12 injections. Your body requires B12 to make hemoglobin. Instead of going back for refills after she ran out, however, she headed over to her local pharmacy, bought vitamin B6 tablets, and proceeded to take 2 per day, and went on to explain how, doc, it's the same thing. Yeah? No.
That reminds me of a buddy from college. He thought he could get fit by just taking any vitamins he found at the store. He ended up grabbing vitamin D instead of what he actually needed. He was so convinced he was doing it right, but it didn't do much for his workouts. We all had a good laugh about it later, just showed that sometimes it's better to actually check what you're taking.
Someone thought they had a strained muscle in their leg because it locked up and they couldn't bend their knee. Then an abscess formed at the top of their leg right at the pelvic bone, and blood/pus started literally pouring out, nonstop for days. Eventually he came to the doctor's office, then straight to the ER, and had an abscess in his psoas muscle caused by a perforation in his small intestine. Yep, pretty far off on that guess there, but apparently it happened right after some heavy lifting. To be clear for all you gym rats, no, it was not in any way associated with him lifting. It was a result of undiagnosed Crohn's disease destroying his intestines.
This reminds me of a friend who thought he just pulled a muscle. He didn't seek help until things got pretty crazy. I mean, he was in a lot of pain and eventually ended up in the ER with a serious condition. Turns out it was something way more complicated than he thought. He never connected it to his earlier workouts. Just shows how important it is to listen to your body.
I had a male point come into the ED complaining of breast lump. He anxiously stated that the mass was very painful to touch and was convinced that he was going to die of breast cancer. After a battery of questions, I asked him to take off his shirt so I can examine and palpate, touch the mass. After a couple of seconds, I turned to him and said, "Sir, that lump is your rib." He called me a dumb kid and asked to see my attending. I was a student at the time. The point asked the attending why, if it is a rib, that it would hurt so much. The doc replied, "Sir, you've been rubbing and irritating the area for days now. You've been hurting yourself. I've never seen a man leave the hospital that fast." Edit. ED equals emergency department. Point equals patient.
It's funny how some situations can escalate so quickly. The guy thought he was on the verge of something serious. It's wild that he didn't even realize what it was. I guess sometimes people's minds just go to the worst case scenario. I mean, he really was rubbing his rib raw and still called the student a dumb kid. Can't blame him for being anxious, though. Leaving in a hurry must have been a relief for him.
Had a friend come to me claiming she was surely dying and had colon cancer. She had dark stool, among some other things, the bloody stool being the smoking gun. I asked her what she had been taking to help with her stomach pains. She said Pepto-Bismol, of course. I told her to stop taking the Pepto-Bismol and told her to go see her primary physician about it. Sure enough, it was just the Pepto-Bismol.
That's wild. It's funny how something as simple as Pepto-Bismol can freak someone out. Your friend really thought it was serious. I'm glad you were able to guide her to the doctor. It's easy to jump to conclusions with health stuff. Sometimes, you just need to step back and get the right advice. It shows the importance of talking things through with someone you trust.
As a self-diagnosing patient, one day notice a white, hard, jagged object protruding from my back gum. Can't believe I'm having a tooth come in, especially since I'm 23 and had my wisdom teeth taken out years ago. Go to the dentist to get some x-rays, and it turns out to be a piece of a tortilla chip.
That's a pretty wild situation. You don't expect to find a snack stuck in your gums, especially at that age. I can imagine the dentist's reaction. It's funny how something so small can cause a major scare. Makes you think about what you eat and how it affects you. You just hope it doesn't happen again. Gotta be more careful with those tortilla chips, I guess.
Just finished med school, so not too much experience, but had an elderly woman come in the ER with new onset seizure. The patient's daughter was convinced her mother had a brain tumor. On review of the medications, turns out the patient had been out of her Xanax prescription for 4 days and had a withdrawal seizure.
Sounds like a tough situation for a new med grad. Having to deduce the cause of a seizure under pressure must be challenging. It's interesting how often people jump to conclusions, especially with someone's health. Thankfully, you identified the issue quickly. That must have been a relief for both the patient and her daughter. It's moments like this that show the importance of really digging into a patient's history.
So I'm a therapist, and I work with kids. Worst misdiagnosis was a family with a 2-week-old who was convinced the baby had 1. Anxiety, because he cries. 2. Autism, little eye contact. 3. Bipolar disorder, because baby would seem content then angry. I spent hours explaining child development, what these diagnoses mean, how they would present in kids. I provided them with books, handouts, etc. They insisted on going to see my coworker and a psychiatrist, as I was surely lying to them. Even after meeting with the other 2 professionals, they still weren't convinced. They requested psych meds from the doc.
That's a tough situation. It's hard when parents jump to conclusions about their child's behavior without understanding normal development. Explaining things over and over can be exhausting, especially when they're not willing to listen. It's frustrating to see them seek validation from others instead of trusting your expertise. I guess some just can't accept that babies cry for plenty of reasons that don't need to be pathologized.
Self-diagnosis? I'm an orthopedic surgeon, so patients are really often unable to diagnose themselves because they don't have the power of MRI or scoping. The most incorrect self-diagnosis I've encountered was a patient who believed they broke their hip after a fall when they actually had a 2-inch piece of skateboard lodged into their side they forgot about.
That's wild. It's surprising how people can completely misinterpret their injuries. That skateboard piece must have been pretty painful. It shows how important it is to get a professional opinion. Sometimes, what seems obvious isn't the whole story. It really makes you appreciate the expertise doctors have in figuring things out.
I'm not a doctor, but a medical translator. I was translating for a refugee patient who asked me to tell the doctor that every bone in her face and hands was broken. She was very insistent that this was the case. She also asked the doctor for a full-body beautification surgery, and this was at a free clinic. It was apparent that her face and hands were not broken, and when I relayed the information to the doctor, he looked very confused. I'm pretty sure the patient was just a bit crazy because they sent her out of there with nothing more than some Motrin.
It's interesting how some people see things differently. This patient seemed convinced about her injuries, but it was clear to everyone else that she was fine. Makes you wonder what goes on in their minds. A free clinic isn't exactly the place for extensive cosmetic procedures. I guess some people just have their own ideas about what they need, even if it doesn't really match reality.
Patient is diagnosed with invasive ductal carcinoma of the breast, confirmed with biopsy. Surgery prep for 2 weeks' time. Patient goes to an outside facility and does a mammogram. Radiologist Red states it is benign. Patient writes an email to her primary doctor, my attending. Prayer works. Please find attached report stating I no longer have breast cancer. Please tell Dr. X, surgeon, that I will be no longer needing surgery. Cue furious emails to surgeon with sense of impending doom. TLDR, mammograms don't pick up everything. Edit to add, sorry there is no resolution at this time. This happened last week. The patient surgeon is now in charge of counseling her to change her mind. Double edit 2 weeks later. Patient has been convinced to get the surgery.
It's wild how quickly things can shift in someone's health journey. One moment, you're preparing for a big surgery, and the next, there's a report saying everything's fine. But then reality hits hard when the surgeon has to step in. It's a tough spot to be in, relying on tests that aren't always definitive. At least she's made a decision, even if it took a bit of convincing. Just shows how unpredictable life can be.
Just a few weeks ago, I had a patient come in for an eye exam. She tells me that her allergies are really bothering her eyes, and she just needs her eyeglass prescription tweaked. Her best corrected vision is 20/80, and her retina is a mess. She's got Stargardt's disease, not previously diagnosed. She is going blind, and there's nothing we can do to stop it. I want to refer her to a retinal specialist to confirm the diagnosis, but she refuses because it's just allergies, and I just need to prescribe her some drops. I should also add that her eye were not at all tearing, itching, and there was no inflammation of the conjunctiva at all. Not that this would cause your vision to drop to 20/80ths, even if they were present.
That's tough to handle. You see people every day, and sometimes they just can't accept what's happening. It's frustrating when someone is in denial about their condition, especially when it's serious. Just wanted to help her, but she was focused on allergy drops. It makes you realize how important it is to listen to your body, even when it's hard to face the truth. Just a situation where you wish you could do more.
Had a patient who was convinced he had contracted syphilis from immoral conduct. After a long conversation, it turned out it was just salt sores from a long period where we on short rations of fresh water, and he had been washing his clothes in seawater. He was convinced he'd contracted an STD from masturbation and impure thoughts.
That's an interesting story. It's wild how people jump to conclusions about their health. Misunderstandings like that can really stress someone out. It makes you realize how important communication is in healthcare. Just a simple salt sore turned into a big worry for him. It's a reminder that our minds can sometimes create problems where there aren't any. Glad it was just a case of bad hygiene.
Real story as a third-year med student. Was rotating through a South Side Chicago hospital, aka the Hood. Female patient in her 50s, sexually active with one partner. Thought she was pregnant and asked for a pregnancy test, since she was not menstruating for the last couple months. Pregnancy test comes back negative. Meantime, we work up the history of her experiencing all the classic symptoms of menopause. Anyways, when we tried to explain to her that it was menopause, a natural physiological response to aging in females, she got extremely upset. Requested for a repeat pregnancy test, which we obliged to. Once again, results came back negative. Tried explaining to the patient once more what menopause was. However, she told us we were making crap up, to put it pleasantly. When asked what she thought was wrong, her explanation, in her words, were as follows. 1. I am pregnant with baby Jesus 2. I need to get a new boyfriend. This current one can't even get me wet in bed. We tried one last time to explain the situation. However, she stormed out and never came back. True story.
That was an interesting experience. In med school, you think you'll see a lot of serious stuff, but sometimes it's about the unexpected. This patient had her own beliefs and wasn't ready to accept the reality of menopause. It's wild how some people hold on to their ideas tightly. You just have to roll with it and stay professional. Not everything will make sense, and that's part of learning in medicine.
Ooh, can I play? Only a vet, not an RD. Real doctor, but a young couple brought me their young ginger cat, requesting euthanasia because he had cancer. I asked why they thought so. They cited A, the tumors on the margins of his eyelids, which were actually normal pigmentation or ginger cat freckles, and B, that there were drops of blood when he jumped into the empty bathtub, which were actually rehydrated flea dirt falling off the cat onto the wet tub. I talked them out of euthanizing their perfectly healthy cat.
That's a pretty intense situation. It's wild how people can jump to conclusions about their pets. Glad you were there to help the cat out. Sometimes it's just a matter of misinterpreting science. The couple probably felt stressed about their pet's health. It's nice to see a vet take the time to educate and reassure them. At the end of the day, it's about keeping the animals healthy and happy.
I was an ER tech for a few years after college in a very ritzy suburb. We get a lot of self-diagnosis and just general hypochondriacs. One time a woman came in via ambulance yelling about how her hands were turning blue and she was worried about her circulation. A nurse, being the smartass she was, took an alcohol, wiped to her hands, and her hands magically weren't blue anymore. Turns out she had bought new jeans and didn't wash them before wearing them. I've never seen someone so embarrassed. She practically ran out of the ER. Edit. Holy shit. Thanks for the gold stranger. Didn't see that one coming.
That's a classic story. People often jump to the worst conclusions about their health. The nurse's quick thinking with the alcohol wipe was clever. It's funny how something as simple as unwashed jeans can lead to such panic. I've seen similar cases, where people's worries are totally misplaced. Sometimes, it's just better to check the basic stuff first before rushing to the ER. That woman must have felt pretty silly after that.
We had a 16-year-old female and her boyfriend come into the emergency room. The girl thought she had had some sort of seizure. Our head medical resident went in to talk to her privately. He came out later barely able to contain his laughter as he came around the curtain. He took the team to a more private area and burst out laughing. In taking her history, he realized she had simply had her first orgasm.
That's an interesting experience. It's funny how a moment of confusion can lead to unexpected situations. I guess that's just how life goes sometimes. People can be surprised by their own bodies. It's a reminder that some things you might think are serious can turn out to be pretty normal. Just goes to show you that not everything you hear in the ER is what it seems.
Optometrist here. This happened while I was on rotations as a student. The practice was used to seeing patients from rural areas educated up to high school, usually some missing teeth. Anyway, this lady was convinced she had a bee in her eye, but it sounded more like "There's a bee in Mara." I had to leave the room to get the doctor, so he could translate. She had floaters. Edit. Lots of questions about what floaters are. When the jelly in the back of your eye degenerates down to a liquid, you see shadows of the chunks of jelly floating around in the back of your eye. Very common as you get older, even common in some younger people who've played rigorous sports, football, gymnastics, etc. Thanks for all the upvotes, everyone. I'm a longtime lurker, and this is only my second post, smiley face.
That's a pretty interesting story. It highlights how communication can sometimes be a challenge in healthcare. The lady's panic about having a bee in her eye must have been a moment. It's a good reminder that what seems serious might just be something common like floaters. Happens to a lot of people as they age, and it's cool to see how simple things can lead to confusion.
Paramedic here. While doing a shift in the ER, had a patient come in only because his wife forced him to go to the doctor. He says his chest feels kind of fluttery, and that's all. Diagnosis: feeling the glass of wine he had with dinner. He had no other symptoms of cardiac. No weakness, sweating, dizziness, shortness of breath, nausea, or anything else. Turns out when he gets put on the monitor, he's in pulsing VTach. Note that it's significant that he has pulses when his heart is in this rhythm, because often there are none. The patient ended up getting cardioverted shocked about 4 times before converting back into a normal rhythm. Even more remarkable, the entire time he was cracking jokes and in no distress.
That's wild. Just a regular guy showing up because his wife was worried, and it turns out he's got this serious heart issue. It's strange how he was chill the whole time. I've seen people freak out in emergencies, but he's making jokes while in VTach. It probably took some serious work to keep him calm. Makes you appreciate how people handle stress differently, sometimes with humor.
Not my story, my dad's, an ER doctor. He once had a patient duct tape a huge bag of weed to his chest and ride his bike full speed into a parked cop car. The guy thought he was in the hospital because of some big government conspiracy that he knew too much about, but it ended up just being a broken arm and probably schizophrenia. He then ended up suing my dad, so he was really an all-around great patient.
That's a wild story. Your dad must have seen some crazy stuff in the ER. It's interesting how some people can get so wrapped up in their own thoughts that their actions just don't make sense. The guy really thought he was on some mission, but it just turned out to be a broken arm. Suing your dad after all that just shows how unpredictable people can be.
I thought I was having a panic attack once. Turns out it was a heart attack. Oops. Edit. Hey, while I am here, can any medical professionals tell me what I had? The cardiologist said it was a heart attack, but it was not because of an internally blocked passage, but because I got a virus that formed a big sac of fluid around my heart and was blocking/squeezing it from the outside.
That sounds pretty intense. It's wild how our bodies can react in unexpected ways. Panic attacks can feel really serious, and finding out it was something like a heart attack must have been a shock. It's good you got to the doctor in time. I hope you're doing better now and that it's a lesson to listen to our bodies more closely.
A few months ago, I developed a bad sore on my upper outside gum. It hurt a lot, and so I asked my wife, a former dental assistant, to check it out. She said it looked like an abscessed tooth. I went into the dentist the next day. Another dental assistant with years of experience took a look and said, "Yeah, sure looked like an abscess to her. Too bad, it's a root canal." She took some x-rays and left. I'm feeling pretty bad about it now. I thought I took decent care of my teeth, so this kind of blindsided me. I started mentally preparing myself for seemingly inevitable root canal. The dentist came in. He's normally a pretty funny guy, but this time he was pretty serious. He looks at the x-rays, peers in my mouth for about 10 seconds, and then stands up and starts elevating my chair. 7 to 10 days. That's all he said. I'm pretty confused at this point. He laughed at my expression and said, "You have one heck of a canker sore, sir. It'll be gone in 7 to 10 days. Today's your lucky day. I've never been so happy to have a canker sore."
That sounds pretty rough at first. Dealing with dental issues can really mess with your head. I mean, thinking you're in for a root canal when it turns out just to be a canker sore is wild. I've had moments like that where a simple problem seemed way worse than it actually was. It's a relief when the worst-case scenario doesn't hit. Glad you got that good news in the end.
Veterinarian, but figured I'd play. 1. Self-diagnosis. Caught cancer from dogs in neighborhood, now covered in tumors all over chest. Real diagnosis. Nothing wrong. She was feeling the dog's ribs. Healthy dog. 2. Self-diagnosis. Worms were crawling out of her cat's nose and through its fur. Real diagnosis. Nothing wrong. She was delusional and probably had dementia. The cat had chronic kidney disease, but she was not too concerned about that trivial issue. 3. Self-diagnosis. MRSA. Real diagnosis. Allergy to the random OTC skin-soothing spray and shampoo she bought at Petco, and then the 3 other creams she used afterwards.
It's wild what people convince themselves of. Like, this one friend thought her dog was giving her cancer. Turns out, just a misunderstanding with a healthy dog's ribs. Another thought her cat had worms, but she was just seeing things. And the MRSA scare? Just a reaction to some random store products. It's funny how our minds can twist things when we're worried or stressed about pets.
My friend had this pain, and after self-diagnosing, came to the conclusion he had some kind of colorectal cancer. On his way to drive himself to the hospital, he got really sentimental and started telling us all how much he loved us. I had never seen him so serious or solemn before. He came back 2 hours later and, visibly embarrassed, told us it turns out he was just constipated. Ever since then, when he tells us he's sick, we just laugh at him and tell him to take some laxatives. Poor guy.
That's a wild story. It's funny how our minds can go to the worst-case scenario, especially when we're not feeling great. Your friend probably learned a lesson about jumping to conclusions. Now, whenever he complains, I can see why you all find it amusing. Sometimes a good laugh is the best medicine, even if it's at his expense. I guess that's what friends are for.
I went in thinking I might have the consumption because I coughed up blood and wouldn't stop coughing. Doctor wrote it off as allergies. When my roommate caught my allergies and started coughing all the time, my grandmother said, "Sounds like whooping cough." And that's how I coughed constantly for 6 months straight. Todd, I was wrong. The doctors were wrong. My grandma was right. Vaccinate your children, amigos.
It's wild how things can get blown out of proportion. You start with a simple cough, and suddenly it's a 6-month ordeal. Sometimes, you really have to wonder about these doctors. Glad you made it through, though. Your grandmother sounds like she has a pretty good grasp on health. A reminder that sometimes things are overlooked. And yeah, vaccinations are important, can't argue with that logic.
Not a self-diagnosis per se. Anyway, not even 2 weeks ago, my next-door neighbor's 14-year-old girl knocked on our door at 6 a.m. Parents were out of town, and were close neighbors. Complaining of abdominal pain and vomiting, took her to hospital. A doctor said she was putting on a show, and it was just a stomach bug. Didn't do a blood test or anything. Few days later, parents had come home, and she was still sick. They were sure of the doctor's diagnosis. Few hours later, we get a call from them, saying that they took the girl to hospital again, and within 5 minutes of them being in there, she was being rushed to a larger hospital for emergency surgery. Her appendix had burst 3 days before, and she was 15 minutes from death when she arrived for surgery. She has only just come out of a coma and will be in hospital for at least 4 weeks and is sterile from the appendix fluid leaking into her abdomen for so long. TLDR. Doctor misdiagnosed a burst appendix as a stomach bug in a 14-year-old girl. Girl is now sterile and lucky to be alive.
That's a rough situation. It's crazy how sometimes doctors miss things that can be serious. That girl went through a lot, and it's wild to think she was so close to a worse outcome. Misdiagnosis can be life-altering, and it serves as a reminder to always trust your instincts. For her, the recovery will be tough, but hopefully, she has support around her. Just a lot to process for everyone involved.
Not a doctor, but my doctor has certainly shared this story enough. So on his behalf, I was misdiagnosed with trapped gas pains by an ER doctor and nearly died as a result. I woke up one morning with a horrendous stabbing pain on my right side near my ribs. It went all the way through to my back. I had my roommate drive me to the ER. The doctor came in and poked at me a little. He smiled and said not to worry, it was just bad gas. Since I was so young, 24, I'd probably never experienced it before. He sent me home with a prescription antacid. This was a Saturday. The pain got worse, and worse, and worse. I went into my regular doctor Monday morning. He said from across the room he could tell it was my gallbladder and sent me to a surgeon's office. My gallbladder had become gangrenous and was about to burst, and the gangrene was spreading to my pancreas. I was in surgery almost immediately. Between the surgery and ICU, I spent over a week in the hospital.
That's a rough situation. It's crazy how one doctor can just brush off something serious like that. I remember a friend of mine had a similar experience. He went to the ER for chest pain, and they said it was anxiety. Turned out he had a heart issue. It's wild how sometimes the signs can be so clear but missed. Glad you made it through.
Patient admitted for chest infection. Young male, around 19 to 20. Noticed his hand had a tremor and weak grip. He'd had the symptoms for about 3 years. Asked him about it. Said it was because he was left-handed but made to use his right hand at school. Kind of thought to myself that's a bit off if he went to school 15 years ago. So suggested we get a look at his head with an MRI. Brain tumor. He died about 2 months later.
That's tough. It's wild how something like a tremor can seem minor but turn out to be serious. You don't expect a young guy to have a brain tumor, especially with a story like that. It's a reminder that health can change quickly. You just hope people get checked out when something feels off. Really sad outcome for someone so young.
I'm an Optum student currently learning, but our professor told us this story about a middle-aged lady coming in for a routine eye exam. He spotted something on her lower left eyelid, and he diagnosed it as a possible squamous cell carcinoma, basically cancer. He told her to seek referral immediately. She then claimed that she was soon marrying a pastor and that treatment won't be needed as she and her husband-to-be will pray the disease away. He never saw her since.
That's an interesting story. It highlights how people sometimes rely on faith over medical advice. It's a tough situation when someone dismisses the importance of treatment. You hope they make the right choice in the end. It's a reminder that not everyone sees medicine the same way, despite clear evidence.
Not a doctor yet, but I work in the ER as a scribe, so I follow them around all day. We had a lady come in and said, "I got crabs." The doctor asked, "Have you seen any of them?" To which she replies, "No, but I can feel them biting me. My husband gave them to me and my kids." At this statement, we were all thinking, what the fuck? However, it soon became clear that this lady had no idea what crabs actually are. She ended up having a mild rash and was discharged along with her family, but that was quite an interesting self-diagnosis.
That's a wild story. People can be really confused about things. It's funny how she thought she had crabs, but it was just a rash. It must have been a moment when everyone's just trying to keep a straight face. Working in the ER, you encounter all kinds of scenarios. At least she left with a simple treatment, and her family. Just goes to show that not everything is as it seems.
Please consider subscribing if you enjoyed. Love.